If your baby is over the age of 5 months old and still waking every 1 to 2 hours overnight, I'm a sleep consultant and I'm going to explain why that's happening. And it's called Behavioural Insomnia of Childhood. And I'll link this article down in the caption. And the subtype that I work with that requires some sleep training is sleep onset association type. And that is a child's dependency on specific stimulation, objects, or setting for initiating sleep or returning sleep following an awakening. And in the absence of these conditions, sleep onset is significantly delayed. So when you hear sleep consultants like myself talk about sleep associations, this is kind of what we're referring to. Sleep associations, although commonly referred to as positive or negative sleep associations, I usually just call assisted or unassisted. So unassisted sleep associations are things like thumb sucking, white noise going on, your baby's sleeping bag that signals to them that it's bedtime, a sleepy phrase and their bedtime routine. And assisted sleep associations are things like being rocked all the way to sleep, patted all the way to sleep, fed all the way to sleep multiple times overnight. And this is what can become unsustainable because commonly after the 4-month sleep progression or after your baby's sleep cycles have a permanent change in their architecture, the way that a lot of babies fall asleep fast becomes the way that they need to be resettled at the end of each sleep cycle. Hello, waking every 1 to 2 hours overnight. And whilst it's really important that you have things like your nap totals, day feeds, the sleep environment, all of those foundations in place, so often the sleep association is what's causing the overnight waking, or rather why your baby is unable to just put themselves back to sleep at the end of the sleep cycle. And that's what sleep training looks to fix. It's undoing or weaning out those sleep associations to support and encourage your baby to fall asleep independently or self-settle so that then at the end of the sleep cycle, they can do that themselves without having to cry out to look to be fed, rocked, bounced, patted back to sleep. And it's important to know none of those things are inherently bad. Again, it just can become unsustainable when nobody is getting any sleep. So that's exactly what I do as a sleep consultant, whether that's one-on-one or particularly with my 5 to 12 month sleep guide. How can we do less of what you are currently doing to help your baby get to sleep? And there are really effective sleep training techniques that do exactly this. My 5 to 12 month sleep guide will walk you through the prep and the plan. It's broken down into 2 parts because you've got to have your ducks in a row before you implement the plan. And the plan will walk you through a behavioural sleep training technique that is evidence-based that will support your baby in learning how to sleep independently so that they can link their sleep cycles overnight and even during their naps by themselves.